women engage in economic activities. In addition, the study seeks to establish whether allowing children join preschool entry age. Additionally, by hosting the ECD network for Kenya, the university promotes nurturing care through national ECD stakeholder forums and community-based advocacy initiatives. In 2024, the ECD network for Kenya, hosted in the Department of Early Childhood and Special Needs Education, held a successful 6-month child care campaign that led to a national dialogue. Kenyatta University has played a pioneering role in advancing early childhood education in Kenya through specialized academic programs, research, community engagement, and policy advocacy. Our Department of Early Childhood and Special Needs Education was the first in East Africa to introduce a bachelor's degree in early childhood as well as special education, and continues to offer certificate, diploma, undergraduate, and postgraduate programs in early childhood and special needs education. These programs integrate theory and practice, preparing graduates to effectively support diverse learners. The university is a leader in ECE research, with faculty and students producing evidence on critical issues such as the quality of pre-primary teacher training and the inclusion of children with disabilities in competency-based education. Findings from these studies inform national policy and classroom practices. Kenyatta University also engages in extensive community outreach and consultancy, partnering with county governments and NGOs to offer technical support, conduct capacity building workshops, and operate model ECD centers. In policy engagement, the university provides expert input to the Ministry of Education and is a founding member of the ECD network for Kenya that is currently participating in various technical working groups with the Ministry of Health, Education, Labor, and Social Protection. Kenyatta University, through its Department of Food, Nutrition, and Dietetics, offers diploma to doctorate level programs specializing in public health, community, and clinical nutrition. Graduates from these programs contribute significantly to nutrition programs across public and private sectors. The university has led impactful community-based research, notably the Baby-Friendly Community Initiative in Baringo County. A randomized controlled trial showed that mothers participating in this community initiative significantly improved their knowledge and practices in infant and young child feeding, with participants over 25 times more likely to meet recommended standards. Similarly, a 2024 study in Kakamega County linked household kitchen gardening to reduction of stunting and better dietary diversity in children aged between 6 to 20 months. Does it mean I cut short the speech of the VC? Do you want me to cut? Okay. All right. So if I'm guided to cut short or just to, because I can't read faster than I'm reading, I'll just go straight to the challenges if you allow me. Is that okay? Universities, now we look at a few challenges faced by universities in promoting early childhood development in Kenya. Universities in Kenya are key to advancing early childhood development, but they also face numerous challenges that limit their impact. These include inadequate funding that restricts investment in ECD programs. Research infrastructure and teaching resources, absence of well-equipped model centers, which hampers hand-on training, a shortage of specialized faculty in areas such as inclusive education and child rights, and which further weakens academic delivery. Weak partnerships in community ECD providers and county governments that hinder the translation of research into practice and policy. Curricula that are often misaligned with the national frameworks like the competency-based education has affected graduate readiness, limited research funding, and weak dissemination mechanisms, which reduce policy influence. Multi-sectoral collaboration is often constrained by fragmented governance. Digital gaps hinder technology integration in training. Cultural and gender norms also limit male participation in ECD programs, reinforcing workforce imbalances as follows. Increased funding for ECD programs is essential and can be achieved by establishing dedicated budget lines, investing in the professional development of academic staff, and recruiting specialists in ECD and inclusive education. Universities should also strengthen partnerships with county governments, NGO, and community-based ECD centers, and then revise university curricula to align with the competency-based curriculum. Finally, as I conclude, establish ECD research hubs and improve access to funding and dissemination platforms such as journals, policy briefs, and public fora to increase the visibility and impact of university research. I'm sorry the speech was long, but thank you very much for listening. Thank you.
At this point, before we transition to the next session,
about VIP room, which we all need sometimes to access in the course of the day. VIP room, which we all need sometimes to access in the course of the day. When you walk out from this door, immediately you go straight and then you take a right turn, you will find the washrooms there. That's a very key, important facility that we felt that we did not announce and we are announcing. Then the other one is for the delegates who are Muslims, next to Kifaru Hall. When you go out, you can just ask for Kifaru Hall, or even that's where the masjid is for prayer time. So thank you so much.
All right, thank you very much. As you can all notice, we are trying to play catch up with time because we are far behind the schedule. So we'll adjust the program a little bit. What shows on your programs is that there's a panel that should be happening right now. Actually, we should be on tea break. So I'd like to call upon the Director General to come and give us his remarks, and I will plead with you to keep it within 10 minutes. Thank you very much. Karibu.
Audible? Okay. She's insisting that, she's pleading that I have to keep to 10 minutes because when teachers are given microphone, they usually talk a lot. Baraza knows that, the director from Busia. Well, chief guest in absentia, PS State Department of Children's Services, representatives, coordinators of AFCAN, ECD Network Kenya, CECs present, directors of education at the county level, at the national level, colleagues from the Ministry of Education. I've come with a few colleagues. Could you kindly stand up? I've come with Mother Odundo there. She's the director in charge of pre-primary education at the Ministry of Education headquarters. And we also have Mr. Dynel, an officer in the same directorate. So they'll be with you throughout this session. CEO, FCD, concerned parties. The Ministry of Education has been jointly organizing and participating in this biannual National ECD Stakeholders Conference, which brings together both national and county governments, state and non-state actors to deliberate on ECD issues. The theme for this year's conference, which is the 6th conference, is promoting transformative systemic change in a child's ecosystem. I know the last time we were in Turkana, this time we're in Garissa, and as the previous presenter said, we need to really focus on this part of the country. And so Therefore, gathered in this conference are therefore key stakeholders, not only from the education sector, but also from health, nutrition, and protection. The conference, to us in the education sector, we consider pre-primary education as a level of education of its own. We have an annual conference when it comes to primary education. Secondary education, you're also aware we have an annual conference, but we don't need to organize a specific conference on our own for pre-primary education because we ride on this one. And therefore, we work very closely with ECD Network Kenya. Chief guest, ladies and gentlemen, the concept of early childhood development and education started in Europe in the early 1800s. The movement of infant schools was propelled by the Industrial Revolution and the introduction of women into the factory labor force. When this movement came to America during the Industrial Revolution, infant schools were set up in churches, factories, and practically the concept of preschool as a place of offering education for children from all backgrounds and run by highly qualified professionals was widely accepted in Europe and in North America. Chief guests, ladies and gentlemen, here in Kenya, the first early care centers can be traced to the 1940s. So the first organized form of schooling for our children in pre-primary level is traced way back in 1940s, when the British colonists established centers to serve both European and Asian children. During the same period, the colonial government established early childhood care centers for Kenya children living on tea, coffee, and sugar plantations. So as the mothers will till the land or harvest the tea and those plantations, the children were kept busy in some corner within the plantations. And that reminds me of what Professor just said here at KU. They even have lactation centers. I'm reminded that, and I'm told the colleagues from the health sector are here, maybe some of the things you need to deliberate on is why up to now we have not implemented Section 71 of the Health Act that requires all employers to ensure that they provide lactation centers within the vicinity of the workplace. It's something that we need to really look at. So, chief guests, ladies and gentlemen, during the same period, the colonial government established early childhood care centers for Kenyan children, the way I said, living, parents who are working in plantations, and feeding centers in the 1950s for under-5s to provide custodial care for children guided by government policy through ministries, projects, seminars, policy papers, and commissions. One of the major notable seminars that brought together stakeholders was the Melindi Seminar of 1982 with support of the German government. The seminar was organized by the Ministry of Education and an NGO called Bananvarla Foundation. The seminar gave birth to what we currently call the National Center for Early Childhood Education and the District Dissemination for Early Childhood Education in 1984. So at independence, our history is a bit on this pre-primary education. It's very recent. It started in 1984 when we started entrenching into our programs. Thereafter, in 1997, we considered pre-primary education as an investment area of its own under the Kenya Education Sector Support Program with support from the World Bank. Ladies and gentlemen who are gathered here today, the first pre-primary education policy in this country was put together in the year 2006, and we recently revised it. And I think you are aware that we have a current policy. And as you are aware, most of Kenyans, especially those in older, the status of the health, care, and the nutrition needs, and link her with health services such as immunization, health checkups, and growth, and also ensuring that the child is school ready. And so as a sector, we are multi-sectorally organized. Education does not work alone. When Professor here was talking about the D, the development bit of it, it's not just education. We work with you people of nutrition and so on. But what I want to say is the promulgation of the Constitution 2010 so that our counties are now being given the responsibility of implementing all the pre-primary education programs. And since then, a lot has been achieved. At the national level, at the Ministry of Education where I work, we have our responsibility, the counties have the responsibility. Our responsibility is on policy, on curriculum, on assessment, on quality assurance, a number of things, and we work with the counties on a daily basis. The counties are in turn implementing day to day. So at the ministry, the policy is in place, and it is implementation guideline, we also have it. We have done our bit. The Basic Education Act talks about the ECD and provides for that. Sessional paper number 1 of 2017 and all that. So this is really very critical. And so as we move forward, we need really to ensure that this sector is completely supported, this subsector. Studies have shown that each dollar invested in early childhood education will generate additional $5.2 of benefits through increased earnings. In fact, people are now saying the kind of pre-primary school the child goes to will even determine the kind of course he or she will do later at the university. So this level of education is very critical. So all I just want to say is that, for example, the counties are doing quite a good job. When Mandera County was coming into place, for example, in 2013, the county council then had only 4 teachers as employees. Today, they have 853 teachers on their payroll. It is a similar story in Wajir. In quantity in terms of teachers are there. But the question for you, especially our county colleagues, are those teachers working? Are they delivering? These are things that you need to look at. In 2012, the World Bank released a report, what they were calling the service delivery indicators on health and in education. In education, they said that out of 100 Kenyan teachers who are in a given day, only 56 are in class and working. The others are absent. They identified even around 2 who are just in class but not teaching. Some are in the compound teachers. Others are away, and so on. And I know since then the TSC has made an effort. They brought in the appraisals and everything that goes with it. So when you have 800 teachers on your payroll, the question is, how do you supervise them? How do you manage them? We need to take it to the next level, because that is what is really important. So recently, the last school term, January, we did a survey with support of the World Bank at the Ministry of Education headquarters. And I wanted just to give some highlights. The report is in draft for and numerous. Only 46%. The others did not manage. And so that means a lot needs to be done. Are these children school ready? We need to ask ourselves. Only 58% of teachers retooled in CBC and CBA. Health of education, we did the curriculum, PP1 design, PP2 curriculum design, materials textbook, book, what we call the orange book. The list of the recommended books are there. So we ask ourselves, why is it a challenge for our counties to buy? This is some of the things that we need to look at. And therefore, the other thing I wanted to highlight is the linkage between the county government and the national government, especially on the aspects of data. So at the moment, Mother Odundu, who's there, does not even know how many pre-primary children do we have in our schools. So the flow of information from the Council of Governors to the national level, because at the ministry we have an obligation to submit data to UIS, UNESCO Institute of Statistics, because globally it is UNESCO that coordinates education. And so you find our data in UIS, we don't have data on pre-primary education. And therefore, that is why the Presidential Working Party on Education Reforms recommended that we have comprehensive schools, where we have, at the moment, the structure is such a way that we have a board managing the primary school and the junior school, and another board in the same compound managing the pre-primary. So we saw that may not be a bit, in terms of implementation, we cannot have 12 board members managing pre-primary, another 12 or so managing, primary and junior. So it's good we put together this. In any case, the children, all our children, this is one country, and we look at it. But you saw what happened. I think we need to, so that duplication of roles in the management between the ECE centers and primary schools is something that we need to really look at. And so again, the Presidential Working Party recommended that we repeal the Early Childhood Education Act and put it together with the Basic Education Act. In any case, basic education definition is from PP1 up to secondary education, something, again, you might want to look at. And so a number of things. I'm seeing my sister there, the moderator, is already See, maybe the 10 minutes are over. But I just want to say in conclusion, we would like to thank the organizers of this conference, the ECD Network of Kenya. The Minister of Education is well represented in this conference. My officers will be here with you throughout, and we're looking forward in participating in the sub-theme groups and breakout sessions. We also look forward to the conference resolutions. Resolutions are very critical. In fact, we should have started with the resolutions in Turkana. What did we resolve? And how far have we implemented that? Every other conference, we start with the resolutions of the previous conference so that we cover ground. But for us, we are determined to work with you hand in hand to ensure that our children are provided for, especially on the education bit. Thank you very much, and may God bless you. Thank you.
Thank you. Thank you very much, Director General, for articulating the issues so clearly and with so much conviction on what we should do moving forward.
My panel, you'll do well. My panel, you'll do well, so that we keep the time. Now, I would like to invite Professor Amina Abubakar. If you're here, please come. I would like to also invite Abdullahi Malim. Please come. And then I want to invite Mr. Mark Eglan, Dr. Ahmed Nathir Omar, Dr. Edwin Saka, and then Professor Amina again. Please, let's come here. Now, what we are going to have is a very brief panel, the FCDC panel, if you have your program. We were supposed to have 1 hour, but please let's be aware we only have now 40 minutes and want to work within the 40 minutes. Please, can you?
Okay, Dr. Ahmed Nadir, in his absence, we have Dr. Mohammed Adan from Mandera, who has also been the chair of the CEC's Health Forum nationally, and now the CEC for Water. So, Dr. If Nadir is not in from Garissa, you can join us, please.
Okay, thank you. So I'm sure you are moving here. Quickly, our panel will just highlight very quick issues and present some findings of studies that have been done. And we believe that as we go through that, you will be able to hear and understand. First, we'll do a very dissemination of a study that has been done. And then secondly, we'll do a very brief panel that was to be 30 minutes, but now just about 15 minutes. And then we will invite you as participants, based on time, to ask your questions. So let's follow. We start by having Professor, and you only have 5 minutes. When you hear my alarm, please. Yes. We move on. She only has 5 minutes, and in the 5 minutes, she'll be sharing with us some baseline findings. Thank you.
Good morning, everyone. Apologies, I thought we would have slides, but we won't have them, and we'll be very happy to just quickly share. So I'm from, can you hear me? Okay. I'm from Aga Khan University. Aga Khan University is part of within the last 4 or 5 years, we have tier districts as our area of implementation, and we have had a very good partnership with FCDC, where we've been able to start by